Hello everyone, welcome to Dental Subjects. Today we are going to talk about the palatine bones. Okay, palatine bones are two L-shaped bones present in the posterior part of the oral cavity. Okay, it is a paired bone. See the diagram? The two L-shaped bones join in the midline to form the hard palate, nasal cavity and the floor of the orbit. Okay, it has two plates, right? It consists of two plates. The vertical structure is known as the perpendicular plate and the horizontal structure is known as the horizontal plate. And it has also three processes. Okay, it is present in this vertical structure. Okay, pyramidal process, orbital process and the sphenoid process that we are going to see in the upcoming slides. Okay, first, they are irregular bones. See the diagram? And with multiple processes that is extending in different directions. Like maxilla, it also articulates with many bones. It articulates with maxilla, nasal bones, sphenoid bone, ethmoid bone, vomer bones and the inferior nasal concha. Okay. Its main role is the formation of the hard palate and forming the floor of the nasal cavity and roof of the oral cavity. We are going to see about the two plates, vertical and the horizontal plate. Okay, first horizontal plate. It is thick and quadrilateral in shape. See the diagram? It forms the posterior part of the hard palate. Okay, it meets the other bone in the median palatine suture. Okay, it also gives attachment to the soft palate and its superior surface forms the floor of the nasal cavity and the inferior surface forms the roof of the oral cavity. Okay, it has two surfaces and four borders. Okay, then the perpendicular plate. Perpendicular plate extends superiorly, that is upwards. See the diagram? It forms the lateral wall of the nasal cavity. In the perpendicular plate, that three processes are present: orbital, sphenoidal and the pyramidal processes. It also contains the greater palatine groove, okay, which contributes to the greater palatine canal within the maxilla. Okay. It also already we seen that it also articulates with the maxilla, sphenoidal and the ethmoidal bones, inferior nasal concha and the vomer bones. Okay. Then the three processes of the palatine bones. First one is the orbital process. See the diagram. Orbital process project upwards and laterally from the perpendicular plate. It is triangular in shape and forms the posterior part of the floor of the oral cavity. Okay, it articulates with the lacrimal bone, frontal bone, ethmoid bone and the maxilla. Next, sphenoidal process. Sphenoidal process project upwards and medially from the perpendicular plate. Right? See the diagram. It is a slender pointer projection. Right? It extends posteriorly to articulate with the sphenoid bone. Okay. Then the pyramidal process. See that two processes project upwards. It projects downwards from the junction of two plates. See, it is in the junction of horizontal and the vertical plates. Okay. Its inferior surface is pierced by the lesser palatine foramina. Okay, it is very short. Okay, it articulates with the maxilla. These three palatine process contributes to the articulations and also it has openings for the neurovascular structures. Okay, let's see in detail what are the important parts in the palatine bone. See, the important part of the palatine bone is the sphenopalatine foramen. Okay. This sphenopalatine foramen is present near the sphenoidal process. See the diagram. It transmits the sphenopalatine nerves and vessels. Okay, the other important parts are the middle meatus. See the diagram. Middle meatus is present just below the sphenopalatine foramen. Then below that there is a conical crest. Crest is nothing but a small elevated area. Okay, that is the conical crest. Below the conical crest there is the inferior meatus. Okay, it is the part of a nose. These are the some parts of the nose. Okay, the others are the surfaces. Okay, maxillary surface, orbital surface, ethmoidal surface. Okay, these surfaces articulates with the concerned bones. Okay, next, the articulations of the palatine. First, it articulates with the maxilla to form the hard palate, right? It articulates along the maxillary surface and continues with the maxillary bone to form the hard palate. It also forms the roof of the oral cavity and the floor of the nasal cavity, right? Next, it articulates with the sphenoid bone. Yes, the sphenoidal process articulates with the sphenoid bone. Okay, then the ethmoid bone. It articulates along the ethmoidal surface and the ethmoidal crest and it forms the lateral wall of the nasal cavity. Then it articulates with the lacrimal bone. Okay, it contributes to the floor and medial wall of the orbit. Next, it articulates with the inferior nasal concha and the vomer bones. Okay, with vomer bone, it forms the part of the nasal septum. Okay, then it articulates with the opposite palatine bone in the midline, that is the mid palatine suture, right? It forms the hard palate. Okay, this is the end of our class as it is a short topic. If you have any doubts, please kindly share it in the comment section. Thank you.